Specific area where the fund is really going to assist here in Zimbabwe, the $6 million fund that you have just signed in? Do you have any area specific? We have got the children with disabilities, we have got those who have dropped out of school, we have got those who are failing even to pay for school fees. What do you think this fund, and how far do you think it can go if it is to go that way?
Yeah, thank you very much. Um, this fund primarily is intended to support the implementation of the National Action Plan for Orphans and Vulnerable Children in Zimbabwe, which is led by the Ministry of Public Service. Within that plan, there are different components. There is a component on strategic coordination and reform. There is the component on service delivery, which includes training of social welfare workforce so that we have adequate capacity to support children. Training and support for the community care workers so that we have people on the ground in the communities to detect and report situations of children, and also direct welfare support when a child has been abused. To be specific on children with disability, we have mainstreamed this across the platforms that we are delivering. For example, in the training program, there is a specific module focusing on children with disability. In the service provision, there are provisions made specifically for boys and girls with disability, including learning and hearing aid, so that we can also take in cognizance their views if there is a situation of abuse. To make you happy, last week, when I was in Bulawayo at the victim-friendly court, I'm proud to tell you that in Zimbabwe, we work with a society that help children who are deaf to be able to extract information from them and provide information to them around child protection. This is all part of the child protection system in place. For children who fall pregnant or students who fall pregnant, we are just concluding now a national study on adolescent pregnancy. That study will tell us not only the number in terms of prevalence of pregnancy in children and adolescents, but the root causes of pregnancy in children so that we can address the root cause. Also remember that in Zimbabwe there is a policy that allows children to go back to school after delivery. Part of the work we do is to support the child, the newborn, the family, and the school to reintegrate back into school. Because when you say go back to school after delivery, it's not that easy. There is a lot of work that has to happen preparing the classroom, the teachers, and the classmates. Sometimes they will come back to a class lower than what they were because of the time they lost in school. So all that is part of the model in what I said earlier on the mental health and psychosocial services that this fund is going to be supporting. So it is a systems approach driven by the national plan that also looks into the different components in making children safe and protected in communities in Zimbabwe.
You mentioned the issue to do with climate change. How does it affect children?
Thank you. In many ways. One is that in climate change, if there is not enough food, maybe because of drought, and families have to rationalize food, children will not have adequate nutrition. When you have water scarcity, there is also the whole issue that children may not have access to adequate water supply, and that's also another issue. So part of the work from this fund is to train families to adapt their nutrition practices to what is available so that irrespective of the situation, we can care for our children. Number two, if there is any element of abuse associated to those issues, we have a system in place with the government and partners to pick up those issues and address them. Let me also use this opportunity to thank the government of Sweden for being very forthright and trusting in UNICEF and in the government of Zimbabwe to take this forward, because investment in children today guarantees a safe, healthy workforce for tomorrow, and that would then spin around contributing to the economy of Zimbabwe as part of the commitment in the National Development Strategy 1 of the government. Thank you.
Earlier we have had issues to do with organizations being advocacy more than doing the real work on the ground. Do you think the fund will come in to, for instance, supply of water, drilling of boreholes, stationery in classes, uniforms, be it anything materially?
The fund will provide material support, but in a different way, because this is the Child Protection Fund. We have another area for education. We have another focus area for water and supply. Specifically, if we go to child protection services, number one, when a child is vulnerable or abused, at the community level, we have the workforce that will identify them, provide them with counseling support, refer them to facilities where they can get support. If a child is abused and needs protection from the police, the fund allows us to work with the Zimbabwe Republic Police. They have what we call the child-friendly unit, who are specialists in areas of caring for children. So the fund will work with the police to make sure that children are offered the best services. If it becomes a legal issue, maybe because the abuse is really great and it has gone to court, the fund will also help. Let me retract into prevention. By working with community leaders and community gatekeepers, the fund will raise awareness, engage parents, engage children so that we adopt protective behavior. So those are the direct service delivery component of this fund. There are other funds and support in education, in social protection. We are under the government harmonized cash transfer program. We provide some funding to households to buy food, to support their children to go to school so that they are not vulnerable. Remember, a child is safe in the household. So we work around the household to empower the household to care for the children for sure, with expert advice, monitoring, and technical assistance. Thank you.
Thank you very much.
Thank you.